Welcome back. As we continue to explore the context within which we'll be watching the movies, I wanted to take a few minutes to talk about psychological disorders. Disorders are not just an isolated American thing, and that might be why they're portrayed in so many movies. But they're complicated. I want us to think about some of the big picture conceptual issues and some of the considerations related to diagnosis, but we're definitely not going to get into enough detail to be the one who diagnoses or to diagnose ourselves. So that said, what are we talking about? Well, there are a couple different definitions of disorders. One is something that's persistently harmful, including thoughts, feelings, and actions. In other words, it's enduring, persistent, and it includes the way we think, the way we feel, and the way we behave. Another set of concerns is whether it's deviant, distressful, and dysfunctional. We need to keep in mind, though, deviance can be culturally specific. What's perfectly acceptable in the United States might be really unacceptable elsewhere, and vice versa. If it's distressful, though, if the person or their family is not comfortable with it, and if it prevents day-to-day operations and functioning, there may be an indication of some need for professional intervention. Professional intervention, in some cases, takes the form of coming from the medical model, which actually dates back to Philippe Pinel's work in France over a century ago. And at that point, it was really a revolutionary idea. He was saying madness is not demonic possession, it's an ailment of the mind. And that led us to the train of thought that we can look at the etiology, the cause and the development, diagnose it using symptoms, treat it, often with hospitalization, and then look at long-term outcomes, or the prognosis. Now, there are some people that are concerned that this kind of says this is something we can treat and we can fix, and they say we need to use the biopsychosocial model, does that sound familiar, to think about it from a number of perspectives, and that introduces a lot of other alternatives for treatment. On the other hand, medical model might have been better than the treatment for demonic possession. So that said, if a professional says, I think we're on a path that a diagnosis is necessary, how does that happen? We use something called the Diagnostic and Statistical Manual of Mental Disorders, and that's the primary reference in the United States. In the year 2000, there are 400 disorders listed in the DSM, compared to 60 disorders in the 1950s. Now, thinking about the implications of that leads the critics, and even some not so critical individuals, to question, are we putting too many labels? Critics say this can stigmatize people, and we're taking every sort of behavior and saying it's a disorder. But those labels can really help healthcare professionals communicate amongst themselves and with the insurance companies. One specific label we want to think about that's talked about in the Thinking Critically box on page 601 is the idea of insanity. That is a legal term, but it creates moral and ethical questions. If somebody's committed a crime, is our first obligation to punish them for that crime or to help them gain treatment for the disorders? So now that said, the DSM lays out information on essentially 5 categories of disorders: anxiety, dissociative, mood, schizophrenia, and personality. I do want to make sure that you read through the definitions of each of those in your textbook so that you understand generally what types of behaviors or what types of disorders would go into those different areas. With the personality disorders, please make sure you notice the scholarly definition of antisocial personality disorder. It's definitely not what our intuitive common sense definition would say it is. Now that said, another thing I want to make sure we look at from a scholarly perspective is the idea or the concern or issue of suicide. The close-up box on page 616 and 617 gives us some great information about national differences, racial differences, gender differences, age differences, and a number of other differences in which populations are likely, or which groups are likely to attempt or to commit suicide. And it also talks about the timing in terms of different points in life. It's some very interesting information to help us understand and gain perspective on suicide. So, what do I want you to take away from this segment? I want you to understand that there's some pretty specific defining characteristics of a disorder. It's not just somebody being crazy or insane, and we need to be cautious about those terms. I want you to understand the implications of labeling, the variety of ways a disorder can manifest, and the suicide data from a scholarly perspective.